on Hiradio.
Hey, you guys. Turn my headphones a little bit louder. Yeah. Get to you. Yeah. Give thanks every single day. Get to you. Yeah. Give thanks every single day. Day after day, as I wake up, I pray. I will give God the praise. I come lead the way. Day after day, as I wake up, I pray. I will give God the praise. Get to you. Yeah, give thanks every single day. Get to you. Yeah, give thanks every single day. You think say it be nothing, no, but this thing it be something, no. Papa God give me everything, no. You know say he give me everything, no. In my trust 24/7. Just no man I want go heaven. So I feel every day, God there we go make come. No matter how we dey trust still we go make come. Yeah, as I wake up every morning, I give thanks that I dey alright. Yeah, he don't wake me up every morning, feel alright. Yeah, day after day, as I wake up I pray. I will give God the praise. Jaja come lead the way. Day after day, as I wake up I pray. I will give God the praise. Jaja come lead the way. Get to you. Yeah, give thanks every single day. Give thanks every single day. I'ma give thanks every single day. Get to you. Give thanks every single day. You think say it be nothing, no, but this thing it be something, no. Papa God give me everything, no. You know say he give me everything, no. In my trust 24/7. Just no man I want go heaven. So I feel every day, God there we go make come. No matter how we dey trust still we go make come. Day after day, as I wake up I pray. I will give God the praise. Jaja come lead the way. Day after day, as I wake up I pray. I will give God the praise. Jaja come lead the way. Get to you. Yeah, give thanks every single day. Get to you. Yeah, give thanks every single day.
The most wanted producer.
They tell us that this particular person or that particular country has greater or more favorable potentialities than the other. They do not tell us that we should unite, that we are all as good as we are able to make ourselves.
Tomorrow, I go change my tomorrow. Tomorrow, we go change them today. Don't you wait for tomorrow. We go change them today. Eh, eh. We know tomorrow gon' be different. And together we gonna shine, shine, shine on. United we will change our story. And forever we gonna smile, smile. But for today, I choose to be happy. And nothing gonna change my mind today. When I go be my portion. And nothing gonna change my mind today. Hey, hey. And my hope is in you. Cause you never let me down. Lord, you don't change my story. And my head will never frown. Oh, my hope is in you. And I'm looking onto you. For tomorrow go be better day. I no go very frown. Tomorrow, I have hope for tomorrow. Don't you wait for tomorrow. We gon' change them today. Hey, hey. You are the one who lights up my day. And without you, I never get this far. No matter what even evil comes my way. You are the one who lifts my head in all. All of my friends have all gone their way, way. Want to ask me how I come this far? I tell them all my hope is here to stay. The Lord Almighty will never let me fall. Lord, my hope is in you. Cause you never let me down. Lord, you don't change my story. And my head go never frown. All my hope is in you. And I'm looking unto you. For tomorrow go be better day. I don't go they frown. Tomorrow, I go change back tomorrow. Don't you wait for tomorrow. He has done it today. Eh, eh. Tomorrow, I go change my tomorrow. Don't you wait for tomorrow. He has done it today. Eh, eh, eh. No, my hope is in you. Cause you never let me down. Lord, you don't change my story. And my head will never frown. All my hope is in you. And I'm looking unto you. For tomorrow be a better day. I know good they frown. My hope is in you. Cause you never let me down. Lord, you don't change my story. And my head will never frown. All my hope is in you. And I'm looking unto you. For tomorrow be a better day. I know good they frown.
What's up, everybody, and welcome again to Africa on Focus. It's me, your host, Miss.ABA, and I'm super delighted to be here with you on this beautiful Sunday. It's one of the last lockdown modes that we will have, basically because, and it's not because of any wrong reason, but it's yeah, the studio just makes it better. I've demanded for change so that also from the studio we can air live and those type of things. So that is really where we're at. But welcome again. It's so good to be here with you today. It is quarter past 7, coming to you live from the city of Amsterdam, CET. And of course, this is your usual place where we talk matters rising as it relates to Africa, and that's why it's called Africa on Focus. We stream from High Radio, Amsterdam's most dynamic satellite and digital radio station that promotes African culture to Africans in the diasporas. And if you are tuning in on Facebook or you're tuning in to YouTube, make sure that you like our page. Make sure that you share. It's totally free to share. And if you are on YouTube, don't forget to comment. Do say hi. Do say hello, hello, hello. And press that subscribe button that is right down there so that, we can interact with you. We can follow you and also know what you are thinking. That's really what it is. Before we get things started, today's topic, we have a very interesting topic to talk about, which is tackling the inequalities in health. Today, later on, let's say in about an hour, we will have a special guest, Professor Charles Agyemang, a professor of global migration, ethnicity, and health, and principal investigator at Amsterdam University Medical Centres. University of Amsterdam. And we're going to talk about how can we address the misinformation and inequalities when it comes to our health. How can we Africans count on more victories during this pandemic? And that is really what we are going to talk about. Of course, I am not by myself. I'm always joined along with my colleague in this, who is Johnny, and he always, joins us to give, like, let me just say, a critical outlook on matters rising in this during this time. So yeah, let's get him on and let's get start to talk. Hello, Johnny. How are
Without any
you?
further ado, without any further ado, let's get Tony in the. Hi, I'm fine. I'm fine. I'm good. I'm
That's good. That's good. Was that, did that
How are you?
echo in your head or something?
Yeah, I did.
It did. Okay. Okay. Well,
I was
I
I
hope
was
it's not
already inviting
muffled.
myself.
You were already biting in yourself. That's good. That's good.
Hmm.
It means that you're showing initiative and
Yes, sir.
you're basically ready for it. That's really what it is.
How are you?
Yes,
How are you?
I'm good. I'm good. Chilling. It's just the same old. I would say that I'm less
Hmm.
inward as before, but
Hmm.
yeah, but I can say that I am kind of learning how much I need to be outside and how much I need to be inside. So I think it's
Right.
a healthy progression and some sort of self-reflection as to what I need and things like that.
Hmm. Hmm.
Yeah.
So, what would be one of the things that you hope in a couple of months' time, or let's say by summer, if either mastered or you've either like figured out like the amount of time you have to spend outside, amount of time you have to spend inside reflecting and all that good
Yeah.
stuff.
Yeah. So I think in a few months I should figure out like how my back to normal setting of work should be.
Hmm.
What's best for me to do, whether I should ensure that it's handled, remotely or fully inside. That is the bit that I'll probably have to figure out. The things I can do yet is work out outside. Like me and this cold, we do not
I
connect.
feel it.
I cannot, like, seeing especially people who do CrossFit working out
I admire people who do
outside.
try it. Yes.
Oh my gosh, do you
Yeah.
do that?
No, 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 no. It's far too cold, and it gets windy too.
Oh, I
It gets
cannot.
windy. Yeah. Nah,
I
neither can
cannot.
I. Neither can I. So I'm with you on that one.
So that one is not made for me. I'll be very happy when the gyms are open because I do find
Uh-huh.
the workout I do in the gym opposing to the one I do in the hall just a bit more effective. You know, I'm
Yeah.
I'm
Yeah.
I don't know why that is, but yeah, I'm figuring most of the things out. I think that I haven't experienced any limitations as far as shopping is concerned. The stores being closed. I don't think
Right.
that's a hurdle.
Hmm.
So far I'm quite cool. I'm not like running mad.
How about the restaurants and stuff? So you can't like go on a Friday night drink or those
Yeah.
social events that you would probably
Oh
do with your
man.
friends. You can't do this.
Yeah. Yeah, sometimes I do have to check myself and say like, okay, if I want to think of like a comfortable thing to do, I should not think of restaurants, you know.
Hmm.
And I think that, you know, when we were in Ghana, it kind of made up for the time that I would need to want to be outside, if you get what I
So
mean.
yeah, I
Yeah.
get what you mean. I get what you mean.
Yeah.
And how's
So
your expenditure? Do you feel like you spend less due to the lockdown and curfew as you would supposed to normally, maybe on socials
yeah,
or on food? Yeah.
I do. I do.
Uh,
I've never saved this kind of money in a while, with
you
the
know
with
what?
the
Wow.
budgeting that I have. I looked at my account,
Mhm.
I'm like, on both of my accounts, I'm like, I got money left, after putting things
Both of
aside
your
for my
accounts,
savings.
yes, sir.
I was like, so what happened? And so
Mhm.
so I did realize that, and it also has to do with just, the the buying food outside, I guess. You just being hungry, going through a drive-through to just get a snack, and um, just eating out and things. I just realized that, listen, out eating is just, it's really unnecessary. The thing I paid for a cup of coffee, it's like you pay at least 250, right? But at home, I have this Nespresso machine.
Yeah.
You get what I mean? I buy mint for my mint tea. I know this is some rich people stuff. Some people would say, but like,
I know
yeah,
what you're saying.
it just saves money. It just saves money. So, it's actually a good feeling to have. With grocery shoppings, I now kind of
Mhm.
feel comfortable to really like maybe get some extra, so I think that's a positive development. What about
Okay.
yourself?
Um. Well, am I saving more? No, not well. Yes and no. I've never been the type to spend on, let's say, these, especially food, like these small things. I would rather like spend money and go on a trip, right? And take my
Okay.
friends along with me. But
Yes.
I haven't been able to do that. So in that
Yeah.
sense, yes, I've saved some travel money.
Yeah.
Even going back and forth to the UK, I haven't been able to do that
You haven't. Yeah.
in, let's say, in 8 months, which is pretty long. So in that sense, yeah, I'm saving money, but I'm not saving that much money because, yeah, pre-corona, I wasn't spending that much outside of
Right.
what I felt like spending. Those were not on, yeah, let's say, uh,
Yeah.
yeah, on hospitality things and stuff.
Yeah.
So I'm okay.
Gotcha. Gotcha. You're okay. You're fine. You're just, doing all right.
I'm still cruising.
That's good. I do like that. I think it was, aside from some of the lives that,
Hmm.
that were lost, I do
Yeah,
feel that it is for a lot of people a place of self-reflection, even good or bad, even for those that lost their jobs, in some sort of a reflecting way, as in like, okay, my planning probably has to be different, or I can look at ways um, where I could kind of build some type of buffer for myself and my family, or maybe consider
right,
other industries to work in.
right.
Yeah.
Hmm.
That's really how I see it. But
But
altogether, without any hesitation, it's been just a crazy, crazy period. And I wouldn't say let's do this again. I wouldn't say that. I was reflecting on that this week, and I wouldn't say, okay, let's do another round with the lives and um, the fear and those type of things. The
uh-huh.
lockdown setting maybe, but not the virus itself.
Okay, and I have a question then, and also to our listeners if they are tuned in.
Yeah,
Um, let's say in case, right, this, or let's say we would go back to 2018 or 2019,
yeah,
and we knew a pandemic was going to happen. The
yeah.
corona was coming. What would we do? What would we have done in preparation for it?
Mm,
Specifically, what would you
that's
do
a good question.
in
I really
preparation
have to
for it?
think about that.
Yes, so we have the entire show to, to come up with
We have the whole two
precaution
hours.
measures.
Yeah,
Hmm.
we
No,
have the whole
yeah.
2 hours to really think about that. I think it is a good question. I think a lot of people would, for me, like I would earlier on. No, that's actually not true, because if I look at the
Hmm.
particular industry I work in, it's actually more, it's more busy. So I wouldn't say, oh, I would regard more industries to look at. You know,
Hmm.
um, I don't know. I really have to think about it. That's the
It's
kind of
really
question that
something
you're
you have to
like,
think about, right? Yeah.
yes. It's like you have to recollect, your thoughts and everything, and then really consider, as in, like, what would be that thing, you know. We'll
Yes.
definitely say that. Definitely say that. Yeah. So, well, welcome to everyone again to Africa on Focus. We meet every week. Probably the last time when we will do lockdown sessions. But the good thing is that in the setting that we have at the studio while we go back is that we can receive our usual interesting and interactive guests. Shout out to Mensa Gary. Mensa Gary, thank you for tuning in every time. How are you doing? How are you doing this lockdown? I know that for you, it's also been quite of a change. Let us know how this has been for you, maybe some of the lessons that you have learned. And so that we can, learn more about that and get to different
Mm-hmm.
perspectives. One thing that I truly enjoyed was, on Insta Live, I interacted with the most random people. They're not random because they follow me obviously, and one had a routine of sniffing. I'm calling it sniffing, but inhaling neem tree, you know what I mean, all kinds of herbs to relax. And
Okay.
some were really, this is a time to pray more, whether they be
Yeah.
Muslim or whether they be Christians.
Mm-hmm.
One guy I connected with from Italy, he was struck hard. He was like, yeah, the job is gone, and I really don't know what to do. You know what I mean? And
Mm-hmm.
that was quite for those kind of people. You don't have an answer because you haven't walked, in their
In the
shoes.
no,
Yeah.
I don't.
So I do realize that it's really refreshing to hear from different perspective as it relates to where they are and how they cope
Mm-hmm.
with this current time. Because here in the Netherlands, I hear the changes they promise, quote unquote, promise, won't be happening. I don't think the clock will be lifted, or that's what I read today on the 30th of
Mm-hmm.
March, because the cases are not decreasing.
No,
Yeah. Did you hear
no,
any of
they're
that?
going back up. So, yeah, so sort of, and if I even read that, let's say they trying to prevent a third wave. So that is the interesting part. So let's say they're definitely not going to loosen things up too much.
Yeah.
Otherwise, they they fear a third wave is going to happen. Though they're still
Yeah.
the vaccines and stuff is going on, a third wave can happen, can
Yeah.
definitely happen. So yeah, yeah, I don't know. I don't know what's what they plan on doing. Currently, we still have this curfew thing going on. Vaccines
Yeah.
are going ongoing. Um, malls and stuff are still closed. Only
Yeah.
supermarkets or places that do sell medication, etc.,
Yeah.
and livestock. But other than that, we're still on a lockdown. For how long? We don't know. We just had our elections. We just
Yeah.
had our elections. So yeah, yeah. To be let's say continue.
Yeah. And really, really connecting it to, my family members abroad, we are behind with the vaccination and those type of things.
Yeah.
Like here, not even a topic like that, if you get what I mean.
I had only 2 million has been vaccinated, and I compared it to the UK, where they are already over 20 million. So that's even though the population in the UK is of course much more than here in the Netherlands, but still they vaccine like 600,000 a day. That's
Yeah.
a lot. So they're
Yeah.
pushing it over there, and that the Netherlands is just behind, but they're keeping up.
Yeah.
But it's all about money for them. That's one of my friends who is French. He's like the Dutch think about money before everything. So
Yeah.
they'll they'll do anything just to save money, and if they feel like this is saving us money,
They
they
would do that.
disregard the health. They would do that. They would take that. Um, but hey, here we are walking behind, but still we're still alive and
Yeah.
living. So yeah,
Yeah, that's
can't
that's a,
complain.
that's a yeah, that's a point. They do think about money and they do think about saving costs. The economy here is more driven on the tax system is probably number one. thing that brings in money. So yeah,
Yeah,
that explains the whole attitude of the Dutch. They know their coins.
they definitely know their points. Yeah.
They know their coins. Absolutely, absolutely. So what we're gonna do is we are touching on our usual weekly news flash, Africa on Focus here. Today we have our main topic tackling the inequalities in health. In let's say about 30 minutes, we have a special guest who will be joining us, Professor Charles Agyemang, a professor of global migration, ethnicity, and health and principal investigator at Amsterdam University Medical Centres, also known as University of Amsterdam. I addressed him as a medical doctor. He corrected me straight away. So why that is, we're going to talk to him about that, and also,
Mhm.
his cup of tea or his idea as it relates to COVID and the Ghanaians here in the Netherlands, the Dutch Ghanaians. I don't know if our community is regarded by our age group as a positive thing. I don't know about you, Johnny, but I feel that our age group kind of sees community as in like, you get what I mean? I don't know if
You mean
that's
the term community of the
the
Ghanaian
term,
or the Ghanaian
yeah, as
community?
in like
Oh, community.
community. If it's referred to in language as like, oh, we have to think about our community, they'd be like, no, we don't. That's the idea that I get. But in this sense, Dutch Ghanaians, Ghanaians here in the Netherlands, that's we're really going to talk about, and of course, we're also going to answer some of your question. But let's touch on this news flash. What's been going on, Donny? I read about this riot police outbreak. Man, people are going
That
crazy
was
again. Like, what is that all about?
another right. That was yesterday. Demonstrations after demonstrations. Essentially just displaying the dissatisfaction
Yeah,
of people here in the Netherlands. Just they're just tired of it. At the awakening of our elections and also the
yeah,
election results, the
yeah,
biggest party remained the biggest party.
yeah,
The top four remain the top four, though some dropped. And so, I don't know, but I believe in the fact that the people who vote, they know what they voted for, and I trust their
yeah,
sense of judgment, right? So I'm not
yeah,
the one looking at the results and blame whatever or claim there is injustice and whatnot.
yeah,
However, from the voting, you could tell um, that the biggest party, which is the FVD, that
yeah,
they I feel like the Dutch citizens are quite happy in the way they handle this COVID situation. So even though we
right,
are saying that they are behind on other countries and they are just behind schedule, if
yeah,
you ask the Dutch um, citizens, or I think they did a poll ending of last year where I did see that they were very happy with Mark Rutte, who is the prime minister here
right,
in the Netherlands. So yeah, but still, people are quite not only annoyed with the restrictions, but also with the fact that you also mentioned it that they will make promises and then when it's time to make announcement, they push it back, they postpone it.
yeah,
So you will have demonstrations here and there
right,
for any reasons, and the most recent one was last weekend.
mm-hmm.
Um, they were it wasn't, but it's always starts as a demonstration and then turns into a right kind of thing, right?
Yeah, mm-hmm.
So, but this time they were chanting coronavirus does not exist. Um, so there is this spirit of even after a year of coronavirus,
Distrust,
people are get so fed up, yeah, that they're like, no, there cannot be any coronavirus and this and
yeah,
that. And you have military men also joining these people, but it's a few really small, it's a select group, right? So it's not a
yeah,
huge, it's not a big group, but it's just the fact that they can go outside and demonstrate and then make a big deal out of it. But
Hmm.
overall, they got shut down pretty quick. And there's nothing more else to say about that than the disbelief that there's still people out there who think
Right.
coronavirus is fake and it's all a conspiracy.
Yeah.
And I don't think it's a conspiracy. I think coronavirus is very real. It's out there.
Yeah.
The evidence is, the proof is there. Where it came from, that can be a conspiracy or whatnot. However, the point is there is something there which is called coronavirus, and you would be very ignorant to believe otherwise, I would say. So yeah,
Hmm.
that's what's on. That's that's
Yeah.
that's it's
Yeah.
what's been happening in the Netherlands last weekend.
So that same energy, like the Tanzanian president that basically ignored it, I was like, listen, it's non-existent, is not the business. That's really, really what it is.
Which
Yeah.
they
So I,
cannot report, right?
sorry.
Which even though if that is the case, they will not they will
They
not
would not
say that
report it.
that
Yeah,
you will
they wouldn't.
never they will not report that he died of
They
coronavirus.
wouldn't. Man. This is definitely a period where it is a test of, the things that we believe in. It is a test of the current systems that we confide in,
Yes. Do we trust them?
and yeah, and also the way, or really a test of what we find really important in life. I think
As
those
well.
are the three,
As well.
three main things that are
Yeah, yeah,
seriously challenged this last year.
yeah. And
Absolutely.
also like how selfish are we really? Um,
Yeah,
just because it hasn't happened to us, does that mean that it didn't happen to someone else? And which is
sure.
also a reflection on our values. So, when people sit back and think about it, it makes you reflect, okay, what are your values within what you said, a community? Do you feel like you are even within a community, and what does the
Yeah.
community feel
What does that,
about
yeah, what
yourself?
does
So
that
yeah,
mean?
what does that mean to you?
Yeah,
Indeed, indeed.
absolutely. Absolutely. I agree. I agree. Well, the riots in Amst, or no, it was in The Hague actually. That is the main place, the international governmental area. Riot police ended that demonstration. About 1,000 people went to, or actually Museumplein in
Yeah,
Amsterdam.
absolutely.
I stand to
Yeah,
be corrected. Who were protesting about the government's coronavirus regulations. And early in the day, City Mayor Femke Halsema had declared the Museumplein out of bounds and urged people to stay away. Nevertheless, a large group of people, some chanting love, freedom, no dictatorship, gathered on the grass, and they indeed said coronavirus does not exist. Let us know what you think, guys. Does coronavirus exist in your world? Should we really be alarmed as the news is making it to seem? What I do get people's frustration and people's questioning, as in like, how can we trust the media? Because now we are, let's say, so much educated that we know the influence of media and how much it
yeah,
can control our thinking. Given
yes,
an example to Second World War, right? It is predominantly media that kind of pushed the ideas of people to think that, okay, we're poor because of other people, the Jews and stuff like
exactly.
that.
All
Um,
right, all right.
but in this case, where it's science, where people are actually dying, it's now gets to the place. Okay, what do we do? What is the right thing
Yeah,
to do?
yeah.
And I think, yeah,
Hmm.
I think that
There,
deserves deserves some thought. Yeah,
yeah. And even just to add on that, there was
yeah,
this like during within this movement, there's also a lot of misinformation, um, in the sense that there was someone recorded a phone conversation he so-called had with one of the hospitals over in Tilburg, I believe. And so he rang the hospital and told them that his friend who works in the hospital ER said there was no corona patients in their ICU department,
Right.
and he was asking them about why are they lying to the Dutch community or to the Dutch citizens that
Yeah.
there's this um, burden of coronavirus victims in their hospitals and all of
Right.
that. But then apparently that was false.
Mm-hmm.
The guy who was making the phone call
Yeah.
actually lied about him about his friend working there
Right.
and telling him that there were no patients at
Yeah.
the ICU department. So this is yeah. So this is like
Mm-hmm.
you can stand for a cause. However, this
Yeah.
whole media, yes, there is misinformation. Maybe on our
Yeah.
side, we don't know all the ins and outs of coronavirus, but there's also a lot of misinformation on the other
Yeah.
side where they do not want to believe
Mm-hmm.
that there is coronavirus and will
Yeah.
actually pick any let's say silly evidence or any silly story as
Mm-hmm.
proof that, oh, see, they are
Yeah.
lying to us. Yeah,
Yeah.
but
I think that
it's unfortunate.
yeah, like I said, for everybody it's like a new type of reflecting mode, some new sets of questions
Mhm.
to ask. What is for you like a way of, or let's just say the important question that you have in this?
Um, for coronavirus, in regards to coronavirus,
Yeah.
coronavirus, um, you know what? I
Yeah.
really don't have any questions to it.
Mm-hmm.
Just my thing is there is so much ongoing at the same time
Yeah.
that you can't really focus on anything. And
Yeah.
matter of fact, we have enough on our plates already. This
Yeah.
is actually this is the time we actually have to disregard the government for a minute and just
Right.
take care of ourselves. Like
Yeah.
literally your brethren, check up on your neighbors, take care of
Yeah.
them, see, all right, they lost their jobs. What can you
Yeah.
do to help them find a job? If you lost your job, um, ask your neighbor to help you find a job, like those type of things. But we can't sit there
Mm-hmm.
and look or try to see institutions or government policies to point finger at that, hey, there's a hole here, this and that, because it will not
Yeah.
get us anywhere. It's not
Mm-hmm.
going to get us safer anyway. So
Mm-hmm.
yeah, from my thing is, within this time, there's just too much going on. You can't
Mm-hmm.
focus on everything around I mean on yeah everything around you. Just focus on the things that are within your you know within your close community, those
Yeah.
things that affect you directly, and those are the
Mm-hmm.
things that you should be very wary of in these
Yeah.
times, and that I am trying to do so. I am
Yeah.
trying to keep up with those things. Yep.
I like that way of thinking. Well, wherever you
Mhm.
are, for those of you who tuned in to Africa on Focus, where are you in this place of your life? Where has this period brought you? And do you trust government or not? Let us
Mhm.
know wherever you are based, and tell us why. Do share with us why so that we can also have an idea about that. In a bit, we're also going to discuss, how COVID measures in UK is doing, especially, for our listeners who are based in the UK, and also a bit of, a lot's been going on as it relates to voting here in the Netherlands. And of course, we will be discussing our usual what's going on in Africa. In the meantime, let's listen to some music. We'll be right back, and let's listen to some Kwabna Awute with his record called Fine Women, and we'll be right back.
I will take to the world. Fine woman, your body like chocolate. African woman, your body like chocolate. Fine woman, taste I will never forget. African woman, Body like chocolate, fine woman. Your body like chocolate, African woman. Your body like chocolate, body sweet like a coke. She shy, shy, so we taking it slow. You did for my mind, but you already know the way she a wine. I go lose my control, lose my control. Oh, say, baby, if I make up, baby, if I make up, so we lose ourselves in love. I go do anything, anything for your love, fine woman. Your body like chocolate, African woman. Your body like chocolate, fine woman. Taste like I'll never forget, African woman. Body like chocolate, fine woman. Your body like chocolate, African woman. Your body like chocolate, the way your waist wine, following the baseline. Take it low, 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 low. Take it slow, low, low, low. Take it easy, y'all go to the enemy. Yo, fair. Da da da. Maybe if I make up, maybe if I make up, so we lose ourselves in love. I go do anything, anything for your love. Miss it from my man, miss it from my man. Fine woman. Your body like chocolate, African woman. Your body like chocolate, fine woman. Taste like I'll never forget, African woman. Body like chocolate, fine woman. Your body like chocolate, African woman. Your body like chocolate.
I don't know. That song just lifts up my spirit. It kind of, it really takes me to, you know, to some positive vibes. And shout out to Curl Songs with his record called Tunnel Light. An artist, by the way, that I wouldn't say he's underestimated. I would say he's underappreciated because that is a Ghanaian artist who is good. And I am talking about vocally good, performance wise good, all of that. And he just hasn't been able to catch a break or catch his break like some of the others, the Kitty and Kwame Eugene and things like that. But I pray that he will as an artist. I wish that for other people. But anyway, welcome back to Africa on Focus with myself, Miss Abba, and Johnny. And of course, every week we ensure that we talk about entrepreneurship, matters rising, and topics that are relevant to global Africans, as I would say. Diaspora matters is what I would call it. And before we go on and talk about our usual news flash. We just want to share that we are streaming on High Radio, the voice of the next generation. If you are listening to us through the High Radio web platform, shout out to you. If you see in our faces and you are connecting with us on Facebook and YouTube and all of that, also shout out to you. Do drop in the comment box where you're listening from, and do give us some greetings so that we could feel the love right in this interesting time. If you are listening on Facebook, do feel free to share. And if you are listening on YouTube, which is through the Africa on Focus YouTube channel, don't forget to subscribe, like, and share in the best way that you can. That Africa on Focus shows up on YouTube every week. A slight commercial break because aside from High Radio, which is the chief, the main platform based in Amsterdam, connecting with diasporas all around the world. Um, I would also like to share that Africa on Focus is made possible by some nice let's just say, black-owned companies that advance the Africa on focus in terms of content strategy, graphics, and all of that would be by Austin. ByAustin.com is, let's say, a branding and communications company based in the Netherlands. And they specifically focus on African and diaspora markets, from personal brands to companies that grow in emerging markets, companies that have been around minimum of 5 years. By Austin will help you put everything in check. Branding, communications, business development, graphics, all of that is what By Austin delivers. They know the diaspora market, which is ever growing, predominantly between Netherlands and Ghana. They will get you on. So do visit their website, or let's just say our website, www.byaustin.com. Even if you have a personal brand and you would like to put things out there, such as a content, a channel, podcasting, they will be able to put everything in structure and bring your story to life. Also, African Focus is made possible by Be Artist. Be Artist is your complete website and graphic design solution. You might ask, what is the difference between the earlier on and this one? The artist ensures that if you want your website done, they will get you the name with emails and all of that, and a full published website also if you need that. So they have everything in one. They guarantee a good service, like they are really at your service, and also for a good price. No shady things. Like if you want an extra email, pay extra £3 or $3. They don't do all that. It's simple. You pay every year, I think on top of my head, €65 or whatever. You get, 5 emails with that, domain name. You can put your hosting on there. And also, if you need somebody to design the website for you, Be Artist fixes all of that. So make sure that you check out their website, beartist.eu, so that they can help you set things up. And they say they do all, and trust me and best believe that they give that promise. I almost forgot to show this picture. This is Be Artist. Make sure that you visit the website and you connect with them. All right, back to Africa on Focus. In, let's say, a few minutes, we will have our special guest here on the show, who goes by the name of Charles Agyemang, who is a doctor. I've interacted with him before, also on a particular event, which was on a visual platform, a virtual platform, and it was quite interesting. You should really hear him, and definitely for our Ghanaian community, it is a good way to get some good responses on how we should go about during this pandemic. But also his journey and how he got things together is super super interesting. So we're going to talk to him about that. Donnie, what else is new? What else is new? Newsflash.
Yeah, what else is new? Shared this very interesting story
Yeah, yeah, I did.
um about fostering, and it blew me away. Here, why
It did.
thousands of West African children were privately fostered by white families.
Yes.
Um, just before you continued on why you shared um that story with me,
Yeah.
for me, I had to find out. All right, so I'm a huge on semantics. So when I read that
Yeah.
West African children were privately fostered by white families, it kind of like I had to look up what fostering was and why privately, and also like by white families.
Right.
And and through that I figured, okay, so what's going on here is white families are actually sort of taking care of African children for African families.
Yeah.
And that literally that blew me away. That was something I hadn't come across or read on and until
Yeah.
now. So yeah,
It was interesting, wasn't it?
that was interesting.
Yeah. Yeah. I also thought it was an interesting topic. Well, not to even discuss it, but just to share, because if I recall, often as a younger girl traveling to UK, I do recall that maybe some cousins, if it comes to, let's say, the afternoon hours, they would stay at their neighbors or something like that, or somehow be related to a white family that, picks them up from school, or, something like that, like in a nanny form, or things like,
Mhm.
something in that direction. But not in this way. I was really surprised to hear about it. And the reason why I read that article was because a business partner of mine shared that when it comes to adoption, now we were actually talking about the topic of, Black people, how we take care of ourselves, how do
Mhm.
we regard the family structure, and do we really love the non-direct family relative that eventually blends in with the family, you know what I mean? And
Yeah.
he made this comment, and he said, upon his traveling, back and forth to particularly East African countries, and sometimes also having to do particular projects for international organization. This is what he said. He said, wow, these children that are adopted and stuff, they are adopted by
Mhm.
white families. They have a wonderful life. Things are improved and blah, blah, blah. But let me tell you, once they are adopted by the Black people, whoa, the suffering they go through. They end up being the maid. They end up being the this, the that. I kept my mouth shut because I was like, man, do these Nollywood stories are, they're they're just probably not, made up.
Yeah.
Um, so hearing about that, it kind of pushed me to do like a personal research on, how is what is the stage of our lives, and how does it go with adoption. I even
Mhm.
researched some cases whereby a white kid was adopted by a Black family, which is relatively, you know um, not
Mhm.
rare, but it doesn't happen in large numbers. It's the other way around. And I
Mhm.
was like, man, is this what this guy is saying? Is this true? You get what I mean? And this
Mhm.
article kind of gave a new perspective on cases whereby it wasn't entirely a full time adoption, as in, like, okay, you're with us for life. It was
Mhm.
still in a way of, your parents, you know,
Yeah.
maybe you even go back to Ghana or Nigeria, every summer, you know,
Mhm.
or maybe the agreement was after 5 years for you to go back, just like one of the stories highlighted in the article. So it
Yeah.
just brought me into this place where I will be really interested to, following up on our episodes, obviously this year, to maybe invite somebody that has been adopted. You get what I mean?
Right.
And really
Yeah.
talk about the cultural differences. Because I did make judgments from when I was younger, when I would see some particular African children being adopted. Of course, they would always end up coming to us in our neighborhood, coming to my mom, because the parents would ask some tips on how to treat their hair and things. And I
Right.
would be like, oh, my gosh, the way they will be brought up is so white. They will probably end up talking like this, and even in actual fact, people consider me talking white. So I was actually being judgmental. And
Mhm.
I then realized, and connecting it to the comment that, my business partner made, I'm like, if we are to look at the condition of their life they have now, is that really an issue? Is that really a point or something to worry about, how Black the
Right.
person would be? You
It
get
will
what I
be. Yeah.
mean?
Mhm.
um it deserved, this is a debate that could go on, so forth, but
It
that
is.
that was my thought process around it.
It deserves a panel discussion.
Yeah, yeah, it does. It does.
Yeah.
I do know one. He would actually be definitely interested to come on the show, who has been he's from Haiti, and
Okay.
actually been adopted full on. So not the case of where you go back to your parents every summer,
Yeah.
but
Fostering.
full on. white area, not just white neighborhood, white area, like the south of the Netherlands, Zeeland. You get what I mean?
Wow.
Uh,
Yeah.
and we interacted. He has visited his parents, basically because he wanted to know where he was really from. But it was so interesting to hear about his experience, the cultural differences, how he
Mm,
is regarded. um, his girlfriend is also Dutch. How even
mm,
some of her friends interact with him differently, you know.
yeah.
Um, so that would be an interesting thing to bring back. Yeah.
Yeah. Yeah. Yeah. But the biggest difference is to be made is adoption is different than fostering in the sense that where fostering is the parents are the initiators of.
All right.
So right, so the parents are the ones who are asking and are actually paying for the white families to take care of
Right.
their kids. Whereas
So that was the case
adoption,
of the
they come,
article.
yes,
Right.
and that is something totally different. And wherein I actually think if in a lot of situations or in a lot of our discussion discourses with cultural differences, I feel like this is something that has to be pushed to the front more often.
Yeah.
Why? Because when we discuss the history on cultural relationships, right, it's mostly from uh, uh, and of obviously due to slavery, it's from a negative point of view towards our let's say our Caucasians or our Western
Yeah.
world in relation to Africans.
Yeah.
However, when you discuss this one on one personally, you will indeed find that, hey, this whole thing that was going on during slavery, there were a lot of white people who were, let's say, so called against it, right?
Yeah.
However, it endured for 150 years, 180 years. And then after that, a lot of things happened. But there's this image created that all of them took part in it. And yes, I would say just a tiny fraction took part, and which were the ones in power. A big part just didn't do anything. And if you don't do anything, you're actually
Yeah.
part of the perpetrator. Um,
Yeah.
and you do have a bit that actually were against it
Mm.
immensely. Um,
Right.
and
So
their
is this
story
about the
had
adopting or a foster?
There's the fostering. So I'm saying
Oh, right.
fostering is part of the story of those who actually resisted racism, those who still to
All
this
right.
day fight for the cause for equality, for the cause of Black people, and this is part of their story because okay, it is one thing to say that, all right, you live in the Netherlands and maybe you're just bored or you don't have any, um, no children. However,
Yeah.
if you are living in a society that actually hates or disregards the life and the equality and justice for Black people,
Yeah.
however, you are willing to take in a Black baby and treat them well and take
Right.
care of them and foster them that they were yours. I think this is actually a good story for the goodness and the kind-hearted bit of that system, that population
Right.
that we don't hear from, and
Right.
that is what I got from this whole fostering thing. That there were white people willing to raise what kind of judgment from their community to raise a wild child, whether they get paid or not. And of course, a lot of adoption also take place where they were genuinely interested in the well-being of that kid. But fostering is also something different. You don't have to do it, and actually, you doing it for the good of their parents, because the parents are the ones who are saying, they want to focus on something else, please
Yeah.
take care of our child. We will pay you for it.
Right.
And giving them the benefit of also raising them on this part of the soil of this part of the earth, whereas their
Yeah.
parents are back home fighting for a better future. I think this is a
Right.
beautiful story that should come to the front more often. And I'll actually
Yes.
do a research to find what are the depths of these, because it's I think it's very important. It's very, very,
Yeah.
very
Yeah.
important. Thank you for sharing.
Yeah. Yeah. That's a good one. And we should highlight it. I mean, I think that we should definitely have one on the show that and really
Yeah,
make that distinction between the foster care and adoption so that we could
and
find out
adoption,
more
right?
about that. I find it a very interesting thing. So that's broadcasting worthy. I
It
could
sure is.
definitely say that. That definitely say that. Well, those of you who just tuned in, welcome to Africa on Focus. Africa on Focus airs every Sunday from 7 p.m. on High Radio. To those of you that are listening through our streaming apps, to tune in, High Radio website, welcome. I know that you can't see our faces because all that you hear is audio. Just showing some love to you. And those of you who tuned in on our Facebook and YouTube channels, do feel free to share and make sure that the word is out. Today, we have an interesting topic that we're going to talk about, and I've seen our special guest is actually waiting for us, so we are going to invite him in a bit.
Mm,
And I touched on today that today's interesting topic is tackling the inequalities in health. And in a few minutes, who will be joining us is Professor Charles Agyemang, not doctor, because that's a mistake I made. So he's going to make sure that that gets clarified. Professor Charles Agyemang. And we are going to look at how can we address the misinformation, the inequalities when it comes to our health. What is even considered as inequalities, and how can
mm,
we Africans count more victories during this pandemic? And of course, because that is something that we always highlight, the journey of Professor Charles Agyemang, of his journey starting out in the Netherlands, migrating and being as he is, because that is always something that we touch on his why, how he did it, and how he got there in a bit. But first, we're just going to go on to a short break, some music. We're then going to come back and invite our special guest. So, in the meantime, if you can and if you will, please be sure to invite all
sure.
kinds of guests to engage in the discussion. In a bit, I'll also share a
Mhm.
number that even if you want to call a number, feel free to share. I will connect you here so that we can hear all of the stuff that you are talking about. So in a bit, we will be talking to Professor Charles Agyemang. Let's do this music, and while we come back, do make sure that you, if you are listening on Facebook, to also like the Facebook page of High Radio, so that of course you could be the first to be informed on when our next shows happen. And yeah, that's it. We'll be back to Africa on Focus. I feel so proud that I've been able to kind of smoothen my voice over that. I haven't been in the studio for quite some time, so being able to do this from a lockdown setting, to do that, that transferring to the music to my voice, that was I tapped myself in the back for that. Welcome back to Africa on Focus, and that was a collab between Ochame Kwame and what's it called, Kwame Eugene. A very fun video calling himself the rap doctor, with, let's just say, the latest high life Afro pop Ghana music sensation on that. So make sure that you check that song out. It is really much trending, as they would say. Of course, you're listening back with me, with Johnny. And of course, we just went into our usual news flash. No time is enough to be talking about the things that are going on in our world. But on to serious things. We have a special guest that we have here on, and I've actually been, I think since ending of last year, been eyeballing him to come on this show. And he is a professor of global migration, ethnicity, and health, and principal investigator at Amsterdam University Medical Centres. University of Amsterdam. The list is endless. Professor Agyemang is currently the vice president of the migrant health section of the European Public Health Association, a scientific chair of the Global Society of Migration, Ethnicity, Race, and Health, and a fellow of the prestigious European Research Council, also known as ERC, under the Consolidation Award Program. Some of the countless research that he's done focuses on ethnic inequalities in health. We're going to find out also what that means, according to his research and NCDs in low and middle income countries. He has published over 300 published papers and edited several books. I can go on and on about his achievements and, of course, his contribution to Africans as a whole. Let me just welcome him so that we get the conversation going and ensure that before 9 p.m., we wrap this up. Let's go. Good evening.
Good evening. Thank you so
Hello.
much for
Hello,
such
good
a
evening.
wonderful introduction. Yeah.
Of course, it is well suited for someone like you who is, let me just say, quite in the underground. We young people call it that. So many major achievements, and one who is just doing his thing. Let me just put it that way. And also, of course, one that I feel young people should know more of, and that's why one of the many reasons we have you on here. We would like to know how are you doing on this Sunday, and of course, where are you in your usual routine? Where are you in this place of your life at the moment?
Yeah, thank you so much. This is truly a pleasure to have opportunity to talk to you and to listen to you. Yeah, currently I'm just at home in the Netherlands. Yeah, so I'm actually sitting in my working room, as you can
Yeah,
see.
yeah.
Trying to keep a little more green to keep me going, to keep me
I can
sane.
see that.
Yes.
Absolutely. It gives a good vibe of
Yeah.
lots of green.
Yeah. So that's yeah.
Right. And could you share with us, has the lockdown made your work any way different? Has this new normal been relevant to you in any new way?
Yeah, I mean the lockdown, as you know, has had a huge impact on research
Yeah,
activities that we are currently doing in AMSA and a whole actually worldwide in terms of work that we do.
yeah,
Yeah, so because of that, I mean, many several projects have to be suspended because of
right,
COVID, and at the same time, we also need to ensure that yeah, we do more research into the COVID, and so that we get more information to be able to help us to get more detailed insight as to what is going on in order to support the clinical care as well as also the policies that can be
right.
used to ensure that people follow the rules. So I have been pretty very busy for the last couple of months, doing a lot of work, looking at what is happening with the COVID and what we can do to ensure that everyone stays safe, and also ensure that the policies that are coming up is based on science, not yeah, conspiracy theories. So that's what we've been doing for the
Yeah.
last
Oh, yes.
yeah,
We know.
yeah.
We know.
Mhm.
I think that really deserves attention, ensuring that everything is scientifically proven, and opposing to just rumors going about and controlling what we do. I think that's really important for us on the other side of the field because you are really on working on the front line, as I would say. For us, it's quite difficult to separate the two, and that's
Yeah.
why we have our usual discussions, and we have people like you on our show to ensure that the information stream that we get is correct. So first things first, because I really had to, I stand corrected because I kept referring to you as a doctor in the medical field, but you're not. Could you clarify that bit so that that would be pointed out?
Yeah, I think that some people get confused because of course, for medicine, you have a different fields. You have people who are working in the, say, in the clinic. We go there, they give you and then you have people who are working on the public health side. And the public health side is basically looking at the health from the population standpoint. So we come out with the policy, for instance, how can you ensure that the health of the public are actually safeguarded before they get into the clinic? For instance, how do you ensure that, how do we prevent people from developing stroke before they go into the clinic? So that means that we need to come out with a lot of policies to educate people so that people actually know what to do and what not to do. And of course, if people end up in a clinic, how can we ensure that those people that have been, for instance, be prescribed medication and others, how do you prevent them? For instance, if someone's got a hypertension or diabetes, how do you prevent them from getting, complications, such as, for instance, a stroke, or for instance, having an amputation? So you work very closely together, and we basically sometimes it's not separable, but it's very important that people see the differences, because basically we rely on each other to be able to work together as a team. So when you come into the clinic and others, you don't see the difference, of course, but there is a clear differences as to who is doing what and who is doing what. But in the end, we all sit in the same place and others. So that's just a little bit of a difference to clarify. Yeah.
Right. And does that allow you to work from where you are, just your office, and not having to be in contact with people that need health assistance?
Yeah, of course. I mean, we do a lot of research. That also means that you have no choice. You still have to see people to basically communicate with people, and sometimes also, because we do a lot of research, and that means that you also need to get people in to be able to examine them, in terms of, say, looking at, if you want to look at the clinical parameters like blood pressure, diabetes and others, then of course you still do have a part. And then of course, the very important part of our work is also as teaching. We teach the medical students what to do, and in terms of from public health perspective. So it's very much, if you like, one big heap. And the only difference is that some people go into the clinic, and we more kind of, if you like, do it from the population point of view.
Right. Yeah. From the population point of view.
Yeah.
Right.
I understand.
And so before we even going to talk about the details of your work, we would really like to know, because that is a lot of times the question that comes to mind of young people, starting their career or after graduation, before it, the journey really of coming to the place where you are, being a professor and being that expert in your particular field. Could you take us to back to your journey? How did it start, and how did you embark on this particular field in the Netherlands, and doing it the way you do?
Yeah, that's a very, very important point. It's also something that I share with many young people, especially young medical students and many people, so that to try to encourage them that it is hard, but sometimes it's also possible. I mean, you work hard. But I think what I would say is that actually, when I was a child, I wanted to be a lawyer. So I was very, I like, I really wanted to be a lawyer. Actually, I wanted to be a big lawyer in Ghana, actually. That was my dream.
Right.
As I grew up and witnessed the devastating dry spells and the bushfires in Ghana, and also the military brutality towards innocent civilians during the coup d'etat. I mean, some of us that are old enough, that actually,
in the 90s?
Especially in the 80s, when I was young, that's actually put basically dashed my dream, because of course you see so many lawyers who were being abused and others. So that dream actually lost because of that, and also because of some advice from my dad once said that, look, see what they are doing to them. And you are very outspoken, so just do something different. So that's actually why I didn't become a lawyer. But of course, after school, I decided to I wanted to study abroad in those days, and I was very lucky. One of the lucky, because my sister at the time was in London, who then supported me to get through UK. And then when I went there, I was very, very lucky to get admission to one of the finest and the prestigious university in the UK, which is the University of Edinburgh in Scotland. So I went there to study. So during my study, I mean, in the masters, I in the medical school in University of Edinburgh, then I did a public health. And again, here, sometimes, we have to be a little bit lucky. And I was very, very lucky to come across a very famous professor. His name is Professor Bupal. Very, very well known, very, very well respected. So he, for some reason, he saw something in me. And he said to me, Charles, I want to supervise you. And then by that time, actually, at that time too, the HIV was a big, big problem. So actually, I had wanted to look go into HIV, looking into a sort of research into HIV and others in the medical school. And then he said, no, why don't you look at the health of the minority population, the migrants and others? Someone else, migrants? Who are you talking about?
Yeah.
And then he said to me, you go and read about it. So the more I went and the more I read about it, and the more you have discussion within the discussion with the team and others, really became a very interesting topic for me. So I decided, okay, this is a really, really area that needs attention. And therefore, I would be happy to do that. And he said that if you are happy to do that, I will volunteer to supervise you, because I know that, you have what it takes. That's what he said. Yeah. So again, I was very, very lucky. So he mentored me, actually, for all these years. So, even after master as a young, usually some people write their masters and they go on. But during my masters, I managed even to publish about nearly 4 papers with my master thesis. So that was really, really impressive as a young man. And then when I was in university there, I met my wife, who come from the Netherlands. So of course, if you are a young man and you meet someone else, you make a lot of promises, don't you? I promised that I will be in the Netherlands, actually.
Right.
So after the course is finished, and then initially I wanted to go to the US, because I knew some group there that I wanted to. They were very, very famous, doing a lot of work. So I wanted to go, but then of course I've made a promise that I'll come to the Netherlands. So in the end, I had to change my plan, and then decided to come to the Netherlands. But I might say that when I was also very lucky when I was coming into the country, because before I even came in, I've already got a PhD position in Erasmus University. So I came in straight from Edinburgh University to Erasmus Medical Centre to do a PhD in medicine, where I looked at cardiovascular diseases among minorities and population. So I must say that for me, a little bit of luck was also on the way, actually. Right. So I studied there for, I think it's 3 years. I was actually very quick. I finished my PhD with no time. And then afterwards, I did a little bit of work. I think just about a couple of months in the National Institute of Public Health, RVM, and Environment. So just about 6 months. And then University of Amsterdam, one professor invited me to come to Amsterdam and see whether I can develop my own research line. Right. And again, I was very lucky to acquire a very, very prestigious grant in the Netherlands. You call it Veni Vidi Vici. It's sort of, if you like, they must get. And as a young man, I was very lucky to succeed. And then actually, many people go for it several times. I was able to get it within one shot. So that was very, very helpful. And that, of course, that gave me the opportunity to be able to start my own research line, and then develop it, and then manage to get a lot of, again, prestigious grant from European Commission, and then set up a very important project called the Rodam study, where you compare the migrants here in several European countries, including Amsterdam, Berlin, London, and then rural and urban Ghana, to give us an idea what is actually happening. And then afterwards, again, I have been very successful to get the ERC, which is one of the most sought. It's one of the most prestigious scientific awards within the whole Europe. And so I got it, and through that, I've managed to set up a team. And now you're doing a lot of work, training a lot of young people. I mean, now, as I said, you have about, say, 6, doctors, clinical doctors from Ghana who are now doing the PhDs. And for the last few years, trained about more than 10 PhDs, and are now over 9 people are also being trained. So I would say that, this is the background. It has been hard work, but it's also a little bit of luck here and there. It's all coming together. And others. But with the hard work brings the luck, actually. So that is a little bit of a background about me. Yeah.
Yeah. Speaking of paving the way, wow. I would just like to know, this is pretty much for me, who is always interested in cultural differences. How does the environment look like in terms of migrants? Scotland, how did the migrants, how did the communities, even the ethnic groups or the migrant groups, look like, and on which specific environment were you looking at? Where was this focused on? I would really like to know. And how was it also for you being Black in Scotland at that time? Was there a community? Wasn't there a community? How did that go?
Yeah, I mean, Scotland, of course, I mean, it looks like it's very far away, but actually, it's, the University of Edinburgh is one of the it's one of the biggest universities in the whole of UK, and it's one of the most prestigious. I mean, it's actually sometimes it come top 5. We have Cambridge, you have London, you have Oxford, you have others, and then you have Edinburgh and others. So you have a lot of different minorities that studied there, all over the world, and also people from the US, all over the place. And of course, Scotland is, it is, I would say that you have, you also have a lot of ethnic minorities there, and I think that actually in terms of policies, it's one of the countries that actually minority do well in Scotland, because it's actually, they are looking for more, encouraging more minorities to stay there. So yeah, for me, I think it was it was one of the best places I've ever lived. It was very nice, although it was raining all the time, but it was very, very nice place. People are very, very nice. Yeah. And then you have the ethnic groups. The key ethnic groups are actually, I would say, the Indian, Pakistani population is very large, and you have quite a sizable African population also living in Scotland, especially in Edinburgh. And of course, you also have, of course, the white, have a lot of English people living there. And so it's Irish, and this is a kind of a large group of people. Yeah, ethnic groups. Yeah.
That is interesting. That is it. That's an area where I haven't heard many stories, coming from. Was it 80s, early 90s? A Black man being in that environment. That's where my question came from, and I love how their journey, even though not the intent, it did bring you to the Netherlands, where basically is where you stayed all this time. Did you ever think of migrating elsewhere?
I mean, I was, as I said, I was wanted to go to the US, but certainly the Netherlands was not on the card. I can assure. And the reason why it was not on the card, because it's a different language, it's not very well affiliated and others. So it was certainly not close to anywhere I wanted to go. So it was just a pure chance that I end up in the Netherlands. But I don't regret it, because it's been a very, very good.
Yeah. And
Yeah.
I haven't heard any desire to be a lawyer at the end. I think this is really
No, I
good.
Serious?
think that the achievement I've managed to do, and also actually in health, I think it's one of the most satisfying areas you could ever do. And to be a professor, being able to really, for me, actually, what's actually has been phenomenal is that, I've managed to fulfill what I want to do. I really want to give back to Africa.
Yeah.
And I think that the combination of working here and also, linking up to many African countries, training the next generation, particularly more so that, the young doctors, training them to see them becoming seniors in their fields and respective field, and then getting experience with research, getting a PhD, I think, and also more importantly, setting up a very nice research that they can use to support policy and clinical care. I think I can never ask for more. So for that, I'm very, very grateful, and I'm very, very satisfied with what I do. Yeah.
Yeah.
Beautiful.
That's really good to hear. In the meantime, for those of you who just tuned in, welcome to African Focus. We're having a very good conversation with Professor Charles Agyemang. So, do people mix up the professor and say doctor a lot? Are people allowed to call you doctor?
Yeah, because remember that actually the way it works is that, ideally, if you do a medical training, you are not a doctor.
Okay.
So in the Netherlands, you see that they write, DRS. So
Yeah.
that's, Dr. Anders. So that means that you become a doctor when you finish your PhD.
Mm.
So exactly. So you have young doctors are working, but we in the academic world, or say AMSA, if you do a medical training without PhD, we don't see you as a doctor, unfortunately. But so
Right.
you have to have a doctorate, which is the PhD, to qualify you to become a doctor.
Mm.
But of course, once you become a doctor, which means that you have the doctor of philosophy, then you have to go through a whole lot to be able to become a professor. First, you have to become a postdoc. In other words, that means that if you finished your doctorate, and then you spend some time, and then with time goes on, you become an assistant professor. That means that a very junior. And with time, if you continue to progress, then you become what you call the associate professor.
Mm-hmm.
And then, of course, the ultimate is then becoming a full professor. And usually can take, and I think for a full professor, it's not many, because, of course, there's not many places in it, and it's very, very competitive. So you have to be on top of your game before you be able to become a professor. So you see, for in our eyes, you have a young doctors who are doing, of course, if they work very hard, and then they move on, and then they become assistant postdoc and others, and then they move on into become a professor. So there's a huge difference between, the professorship and then the doctors and others. So that's how it works. But of course, in the outside world, people don't see the difference. So there's a clear difference.
I understand.
Sure.
Can you become a professor without teaching or without being in the academic field?
No. The idea is that, the way it works for the professor, of course, in some, how do I say, in some places in the US and others, sometimes they call college professor, but that's different.
Mm-hmm. Yeah.
As a college professor, you can just teach in a college, and then they call you as a college professor. But when you say academic professor, that means that you have to be actually in the university. You have to actually, the professorship actually comes back with the research that you've done. It's actually, if you like, it's an expertise. So that means that you are an expert in one specific area, and then you hold what you call a chair. So that means that, like me, when you're addressing me, you say the professor in global migration, ethnicity, and health. So that means that is my chair, the chair of being specialized in global migration, ethnicity, and health. And that also means that before you do that, that means that you have to basically do a lot of research to substantiate that. So you cannot be a professor without being sort of not having published. And that also means that once you become a professor, whatever you say matters because you are an expertise in the field and others. So yeah, so the question is that, you need to be in academia and you need to have a tremendous amount of, or I would say a very great track record before you can become a professor, particularly in the Netherlands, because the competition here is very, very fierce. Yeah.
Okay, I understand.
Mhm.
So that means that in your road to becoming a professor, and still in your researches, you probably see a lot of papers. You get lots of new data, lots of you get to draw conclusions or even reflect back upon things that you thought you knew, and that with new data you have to draw other concepts or theories based on that. So then what are things or significant developments that you've experienced in your in public health, or yeah, that you feel like, all right, these are things that actually really matters, especially to migrants or to Africans?
I think that, I mean, for me, as I said, that, I've done this work, particularly on the migrant health for many, many years, actually.
Yeah.
And I've set up a series of projects, which is having a tremendous amount of impact, not only in the, say, in the Netherlands or in Europe, but also in Africa, which I'm very, very pleased about. As I said to you that, I have two hats. One is here in Europe and one is in Africa. And I want to ensure that everything that I do has a benefit to the African population, not only here, but globally. And that's always been my dream.
Yeah.
So in doing that, I mean, I have done a series of work, and one of the work that, as I mentioned it to you, is called the Rodam study, which is actually quite unique in the world, where you look at the those that have migrated, and then you compare them back to those that did not migrate. And that gives you the opportunity to be able to see actually what is changed upon migration. What are people actually doing that actually put them into, say, develop a specific conditions? So this work has been a huge, huge hit, actually, and a huge, huge success. And if through that as well, we've actually managed to, as I said, train so many people, PhDs, masters, BScs and others. So there's been a huge, huge part. And more importantly, we are also using the knowledge that actually has come out from that work to be able to basically support clinical care. For instance, if you go to your doctor, I mean, the doctor will be prescribed for you, but the doctor needs information. They want to know that what is happening with this population. So you can take a doctor, as a doctor is up there, all the information that the doctor is giving is based on what you call the clinical guidelines. And those clinical guidelines is actually shaped by those research that we do. And that's why it becomes so important that the research needs to be taken very, very seriously. Sometimes people don't, or people underestimate the power of this research. So we have done a lot of this research, and you've also probably heard about the Helios study, which is also also one of the investigators, actually. So we've done a lot of this, and then in between this as well, we are doing a lot of work in Ghana in many fields. Now he's doing some work looking at, for instance, how does the people with amputation, from, for instance, as a result of diabetes, how is the clinics actually looking after them? Where can we improve that area? And also, as we mentioned in terms of theory, how can we actually come out with a theory that makes sense so that you can use it to improve the health of the minority populations? So all this field has been a field that you've been developing over the years. And of course, naturally, when you start developing this, you write a lot about it, because then you really want to try and get your thoughts up there. I mean, as I said, you are talking about minority. I always say that, I always hide behind the right, because if you, for instance, if you are a minority, you go to the ministries and others, you want to talk about, probably people might not take you seriously.
True.
But if you write it and it goes into the scientific journals, and people, people see that this is the message, nobody can dispute it. And that's why it becomes so important. The science, comes, and that's also why for the last few years, I'm doing whatever I can to try to build capacity in Ghana and many of African countries. And that's why, I say to you that you have a lot of junior doctors who are currently being trained by myself, giving them the PhDs. They go back so that they can actually use it to improve care and the services that they provide.
Yeah, I love that. I definitely love that. So here comes COVID. Addressing, addressing is even an understatement, but specifically, touching on matters within minority groups. Man, how has this impacted your field of work specifically? Because I could imagine that a lot of people will come to you to ensure that questions are answered. That is one. Hi Denta. That's Denta. I'm watching. Shout out to her. That was super random, I know, but that is one of our key noted figures in the Ghanaian diaspora from the UK. Thank you so much for tuning in your busy schedule. I know that. But back to the question, Professor. Could you share with us a bit of the highlights of what your work now looks like now that the topic of COVID is so real?
Yeah, I think that the work that's I said to you, some of the work that you've done, especially the Rodham study and the Healy study, has given a tremendous amount of information. For instance, we know that many of the chronic conditions, such as heart diseases, stroke, diabetes, hypertension, many of these conditions are actually more common among the minority populations.
Right.
And you also know that in terms of care, for instance, access to care is also a problem, and usually because of communication. Yeah? And it's also, again, sometimes, how do I say, discrimination. There's so many different factors that actually do that. And that's actually can be linked to the COVID, because what we are seeing in the COVID situation is that if you look at the rate of, in terms of infection, and also in terms of the mortality or death from the COVID, you see that studies coming from the US and the UK and also from our own clearly show that the minority population are more likely to be infected and more likely to be admitted to the hospitals, And I think that, you also have learned a lot about the COVID for the last year or so. That, for instance, we know that if you have a chronic conditions, such as heart diseases, chronic kidney disease, if you have a higher rate of hypertension, diabetes, obesity, your risk is up to nearly, in some cases, is up to 5 times, especially if you take a chronic kidney disease or so. So that's also tied us up and tells us why we are seeing such a huge inequalities, because we are not able to, basically address the inequalities in terms of the chronic conditions, and that translates into people getting more caught up in the COVID. And of course, what we also know is that COVID is a social issue. Sometimes we tell you that people should keep social distance and others, but remember, if you are living in a household where there is no possibility to do social distancing, that might be an issue. You also know that many people, probably you and I, will be able to work from home or be able to sort of have a secure office where you separate yourself from others.
Yeah.
But if you end up being on the front line services, you have no choice. You have to go to work. And that means that you become more susceptible in catching the infection. So there's a lot of multiple factors actually explain why the minority people have actually got caught up in it. I mean, you have done a lot of study also here in many countries, but in the Netherlands, we've done some study which actually shows that, unfortunately, our Ghanaian population and other also minority population have been more caught up also. So in that regard, it's not new. But of course, that, I always say that sometimes it's very important that you call the spade a spade. And you also need to address the elephant in the room, Myself has been attacked. People are saying that, oh, why do you bring this information out? Just keep it, just keep it. If you come across that, the Ghanaians are not doing well, just put it under the carpet. Don't let people know. But how can I do that?
Yeah.
So, and it is not only here in the Netherlands. I mean, in the UK and the US, now it's a lot of talk around. How can we address these social inequalities? So we need to do the same in the Netherlands, and that's what we are doing. So we need to expose it and let people know that this is a problem. Even someone told me that, I shouldn't even say that the Ghanaians and other minorities are poor in the Netherlands. You'll be deceiving ourselves. People know you are. So you don't have to go there because people know the minorities everywhere are disadvantaged. So if you say to ourselves that you shouldn't let people know that you are poor, and then you'll be deceiving ourselves. You need to voice this out so that people can receive care or to receive help that they need, particularly those that are vulnerable. So basically the bottom line is that COVID has clearly exposed a huge inequalities between the minority groups, and actually exacerbate already the inequalities that is already there, because you see that so many people are becoming a victim. And my actually fear, particularly, is that if you do have this COVID, there is still a lot you don't know. Now you have issue of what you call the long-term COVID. That means that if you have the COVID, it can have a huge impact for the long term. Right. So if a lot of people get it and others, then that can, in the end, if you don't do something about it, can actually exacerbate even further the inequalities that we are seeing.
Yeah, because I was even shocked to hear the last seminar that we did that people would even threaten you.
Yes.
I was surprised.
Yeah. So some people even threaten me, saying to me that why do I have the study, and then to tell people that the Ghanaian and other minority do have a problem, and therefore we should actually even some people even go further to say that we have taken money from the government to do some work to put it now, and then you look at, for me, as a researcher, as a scientist, as a university professor, you just laugh about it. Sure. But the problem here, is that, in the process of doing so, you put the vulnerable people within the community at a higher risk. Because there might be a young people who might be able to work along. But remember that, if someone else has kidney disease, they have something within the community, these people can get killed or, very ill very, very easily. Yeah. So we need to be, how do I say? You need to be very cautious and to watch what we say in terms of, because if you do that, in the end, it's the community that suffers. It's not me. For me, it doesn't even affect anything. It's not going to affect my work because I'm already too busy. So I can always do anything. So the work that you do in the community, actually, I would say that it's just a laugh. To come in and do, spend time going to the churches and going into the community. You don't get paid for it. Nobody gets paid for anything. But you do it out of love because you know that, it's very nice that you get into the community, be more connected to the community and make the community develop like any other communities. So we need to ensure that those people that are actually making this program, I would say that these are the enemies of the community because they don't want the community to develop. Actually, they just want you to, just sit on your own
Yeah.
environment, you don't get out, I would say.
Yeah.
Yeah.
Yeah. We also call them enemy of progress. That's
Enemy
also
of progress. And I think that actually is a beautiful saying by Stephen Hawking, says that I put it. He says that actually in terms of science or in terms of academia and others, he says that the threat to knowledge is not ignorance, but rather illusion of knowledge. So you have a lot of people up there who think that they know.
Yeah.
So they come out with so many things, but they don't know.
Yeah.
And then that means that they come out with many, many things, and then they start basically putting things to people's minds, and then make people make a decision which is the wrong decision.
Yeah.
So I think that as a community, these are the people that we have to be very, very careful about. Otherwise, they would, they will make things worse for us.
Yeah.
Yeah. And these type of people, you do find within your own, let's say, within the Ghanaian community, they're also there, right?
This was from the Ghanaian community. This threat was not coming from anywhere. I've never actually seen it. So actually now, I also have a very close, as I said, I work very, very closely with the University of Ghana, Kwame Nkrumah University, and so now it's becoming a laugh. So sort of, with the dean of the medical school, and so you all laugh about it. Charles is getting money, and so yeah, but it's coming from the Ghanaian community, yes, and more importantly from the church that we support.
Okay. And how do you go about with these things? Because they are the ones who will probably come with conspiracy theories and also with a lot of misinformation or half truths that they've read or they've heard from others. How do you combat this?
I think that is why it becomes so important, particularly the program you are doing to provide a fact and others. And I think that we've also been very how do I say it? I'm actually I'm a natural outspoken person, I don't take these things at heart, because I know that if you get someone else who doesn't know, then it means that these people I would call them, this is the danger. So that means that we need to come out and make a plan and get information to the community that they need. So what are my wish is that you continue to provide information, the right information. Of course, you give the information up there. In the end, it's you, the individual, who have to make that decision. But the danger is that you have to be very careful. And I think the most important point I will make is that ensure that the source of the information that you are getting is coming from the right source. Actually, I've got some video, for instance, people saying that if you get a COVID, and then how do they call it, soboro or something like that, you have a ginger, you have a ginger, and then you add you put a little bit of a lemon in it, and then you drink it, and all of a sudden become a Superman, and all of a sudden COVID will come in, and then it will not even see.
Right.
So the point is that we need to be real.
Right.
You need to be a bit more educated, and you need to become real that there is nowhere that you're gonna drink how do I say Osobola, and then you think that the COVID would then see you and just say that, oh, I'm not coming close. So we need to be real. And we need to ensure that the information that you have is not accurate, because if you don't, in the end, you become the victim. And I think actually that also has to do with the vaccination part of it. You know that the minorities are those that actually need this vaccination very, very badly.
Sure.
If you go to the US, now they're beginning to prosecute people. Even the rich millionaires are basically trying to cheat the system so that they get the vaccine, because they know that this is where they can be saved. And if someone comes to you and tell you that, oh, the vaccine, or they're going to come in and, how do I say, to use you as a guinea pig, and then you don't have to take it and others, And then you sit down and just say to yourself, even before the vaccine will come into the market, they've already tested in the thousands and thousands.
Yeah.
So why do you actually come out with this in the first place? And then there is this, how do I say, G5 is all connected with, sometimes you have to sit back and think.
But can you blame people for
the coronavirus? So my point is that, when you hear all these funny stories, let the common sense work. Even if you don't, you just have to bring the common sense back into the equation in order to stay safe, because otherwise you get taken away, and in the end, someone might say that they might survive it. But if you have a very vulnerable people in your communities, this is a very, very dangerous issue. Yeah.
Right.
Yeah, I understand.
Yeah, it's good that we can laugh about it, but it's quite serious.
Yeah.
And the rumors, or just say the story surrounding it, really puts people in the wrong place.
Yeah.
That's really what is happening.
Mm.
In just a few minutes, we'll take on some questions. We're getting some questions from viewers that are listening. I actually promised to share the number, but upon my excitement, I definitely went straight to the comments. Shout out to D Narrow, who is given a thumbs up for just what you are just sharing with us. And also a shout out to Mensa Gary, who's saying, well spoken, Professor.
Thank you.
And also Kwame Ananse, who's saying, quite an experience. Thank you for sharing your story, Professor Agyemang. And also a shout out to Dr. Razak Jesse, who's saying, very impressive story and experience. Thank you for sharing, Professor Agyemang. And also in a bit, we'll be taking on Mehdi Sebi, who has a question, so that we can also touch on that as we almost round up this conversation, as we talk to our professor, our very own one we should definitely cherish. And also, we love the fact that you are as outspoken. It really connects with the younger generation. So even if the older ones might not show love all the time, you definitely get enough love from us.
Thank you. Thank you.
Definitely.
So if we, because one of the important things that I would really like to ask before we even round up, I know time is already much spent, is this thing with the antibodies. The topic of the antibodies came in the news head parole, if I even recall, um, covering or highlighting the fact that Ghanaians would have some sort of resistance to COVID 19, which even after reading the article, I was like, is this positive news or is this negative news? Um, okay, could you clarify what the information about that is, and what are these terms antibodies mean, and what are the dangers associated with these terms?
Well, I mean, if you hear a lot about the antibodies, basically, antibodies is just a simple. If you put in a very simple term, it's just a body defense system. So for instance, if you come across, say, if there's a virus enter into your body, the system is made in such a way that it fights back. It raises, different levels of, say, proteins specifically to try to counteract it. And what makes antibodies so amazingly that any virus that come into your body, the body will be able to see that, okay, this is the virus that come into my body. I'll give it a code. And then it gives a code so that next time if the virus comes again, it remembers it and it raises up these antibodies and then fight against it. So in a way, it can be advantageous.
Right.
But the problem with that, particularly the work that we did earlier, in relation to the COVID, is that, the antibodies, you would develop the antibodies after you have actually contracted a specific virus. And the body system, as I said, raise up against it.
Right.
There are many times that actually the body get overwhelmed by the virus. So that means that many people, who are unfortunate, particularly those that are immune system are weak, can be killed by it. And that's why you've been actually, from day one, you've been trying to ensure that you don't want to get it before you get the antibodies.
The antibodies, yeah.
Exactly. Because not many people will be able to actually fight back. You see? So actually, if you put it in a very simple term, particularly those of you that are, just like, having a country and having an army. So the army is kind of a defense, ensuring that nobody comes in and others. But the problem is that sometimes you might have a very powerful enemy coming into you, and then you will not be able to defend yourself. So they will actually beat you up. And then, of course, afterwards, you remember that those of us that survived, remember that, oh, these are the people that came out and beat us up. But so many people have already lost their lives. And that's why we just say to them, the fact that you have a high level of antibodies does not mean that you are immune. It means that the enemy has been to beat many people out of it, and in the process leave their traces. Right. And the problem, another point of the antibodies is also that I want to emphasize is that the things is that the antibodies usually when it comes in, remember that the fact that you have the antibodies does not mean that you are not going to get the conditions again. It means that you have developed the defense system to be able to counteract it. It might come again and might overtake you. And more importantly, what's also what we know that we don't know actually as to now we know that, based on the studies that came out a couple of weeks ago, that you can actually develop the antibodies and be able to resist it for a couple of months. But you don't know how long you're going to be able to maintain it. And that means that, you have to be very, very careful, not able to get not to catch it before the antibodies leave its traces. So effectively, when you say about these antibodies, that is what it means. But you can look at it in a very different way. There are ways that you can actually determine the antibodies, but we determine it and it tells you whether you have developed, say, the COVID in the past. It doesn't tell you whether you develop it now. It just given an idea that, oh, Charles Agyemang, he's done the test. He has actually been exposed to the COVID in the past. Yeah. I was been lucky to survive it, say, if I had developed it. But many people that actually get it might not have been survived. And that's what we see in so many people, as I speak today, almost about 122 million people worldwide have actually contracted the virus. And over, more than 2 million people have died from it. Yeah. This is it's massive. So why do you then wait to get the virus and then try to just say that, oh, I've got the antibody, so I'm doing okay? You might be doing it, but you've been very lucky that when it actually get into your household, you were able to survive. Yeah. But many people didn't. So that is actually, I would say that a very simple way of explaining the antibodies that you've been hearing about for the last few months. Yeah.
Yeah. Thank you for clarifying that. What about the new variant of the virus? What is all that about? And like
the variants, of course, if you have any other virus, what happens is that the virus continue developing different. When you say variants, basically it's sort of, changing the way it is. Sometimes it come in a little bit of soft green, sometimes kind of a little bit of, sort of they are playing up. And actually it's also just like, if you put it in a very simple terms, if you have a family, if you have different characteristics of each other. Some people come in different forms, and some can be quite deadly. And what we currently know is that, so far there has been 3 key variants who are actually shown to be quite deadly. And the one, exactly, so that is mainly the UK variant. You call it the Kent variant, actually, because it different from the Kent in the southern part of the UK. And you know that actually it can spread very, very quickly. So, and it's also actually can be more in terms of the consequences can be more fatal compared to what you call the wild type. In other words, the wild type is the original format. So that actually spread very, very fast. And that's why people get worried, because they know that, it can jump very, very quickly compared to the original one. And then you have the South African variant as well, which is also very highly transmissible. In other words, it actually can transmit very, very quickly. And the danger about that one too is that it can actually evade the immune system. Because you can, as I mentioned it to you earlier, the immune system try to sort of, if you like, try to steer against the virus that is coming. But it develops itself in such a way that it can hide itself from the immune system. And that's what makes that one is also a little bit quite, a little bit dangerous. And more recently, you have another one, which is coming from Brazil also. So the Brazil variant is also seems to be very, very, it's also kind of very different types of mutations attached to that. And that can also be, very quickly transmissible as well. So there is a lot of variants up there. And that's why it's also so important that we able to sort of do this vaccination so that you prevent the COVID from trying to turn into different sources. But the good thing is that luckily, most of the vaccines that are being developed are equally able to target most of these variants. So that is a good thing about it. But of course, you don't know which variants is going to develop next. And that's why it's so, so important that those of you that have the chance to get a vaccine needs to get it. And for me as a person, if you know someone else who have died from the COVID, you will know exactly what you are talking about. And I keep on using the example of my own good friend. He was a professor, was actually the head of the Ghana, how would I say, School of Surgeons and others. He was the director. Yeah. And he died from it. He worked so hard, really, really hard, doing anything. But, he died from it. So it is real. So if you hear people saying that it's not real, and then you see intensive care full, people are struggling to breathe and others, then you make you think, what is actually going on in people's mind? You see it, is the evidence is there. Yeah. Anyway, sorry, I'm getting emotional here. So, but
I get it.
It's a little bit so frustrating, actually. Yeah.
We definitely understand the emotion. Speaking of vaccine, connecting it to some of the questions from our audience, just so that we do that before we even round up, because we know we've taken a lot of your time.
No problem.
Mehdi Sebi, who says, what measures or things should the community, so I assume she's referring to African community, Ghanaian community, do to prevent COVID? What should they do?
I think this is a very, very important question, and I think you've been doing this, very much. Actually, myself as well. I mean, when we actually get this news, I work very hard. I actually managed to get a meeting together with the in Amsterdam, the mayor of Amsterdam, together with the community leaders, and the mayor was so helpful. She was very listening to everybody. She spoke to all the community leaders to try to help them to basically to help themselves. So I think what I would say first is that, the community need to take this very, very seriously, because first of all, again here, I will just speak out because I know there is a lot of people who are sitting with, say, obesity, who are sitting with hypertension, who are sitting with diabetes, who are sitting with chronic kidney disease in the community. And that means that, we need to be extra careful, because if you don't, this is going to hit people very, very hard. If it doesn't kill you, it's going to give you a lot of side effects for many, many years to come. So that means that, the funerals that we go, I'm not saying that you shouldn't mourn, you should mourn, but we need to take the measures very, very seriously. We need to ensure that, we're wearing our masks. We need to ensure that, we need to keep the social distances. You know that, in our community, we love each other. Everybody wants to say, hey, hi. but this is the time to do it. So that means that, you need to be very, very mindful of what we do. Another important point I think I would say is that, of course, we all love going to church. It is good that we worship God, but God is also giving us the brain to know what is going on. So that means that if you go to church, you need to be very careful the way you do it. Because you remember that, God have told us, God have managed to figure it out for us, what COVID is and what it can do. And it's, and it's been killing, if you're a pastor, if you're a father, it doesn't spare anyone. In Italy, it killed so many Roman Catholic fathers because they didn't know. So the fact that you're going to church doesn't mean that you are protected. In fact, COVID will be laughing at you very, very hard if you pretend that God is there and then I can do whatever, God will protect me. This is not what God is telling you to do. So that means that you need to be very careful when you go to church. You need to be very careful whatever you do. You need to basically keep the social distancing. You need to put your mask on. And more importantly, you need to be very, very mindful about this misinformation that is circulating within the community. Particularly, what's it called it again? Osubulo or whatever, these concoctions.
The spicy drinks.
Exactly, the spicy drinks and others. We need to be very mindful about all these things and take the measures, because in the end, remember that any small action that you do in the community can have an effect on other people, particularly those, as I keep on saying, those that are vulnerable. So you need to be very, very careful to ensure that we follow the measures. We pretend sort of try and stay away from conspiracy theories, and then we ensure that we get the right information and follow the rules that has been laid down. And if you do that, we'll be able to protect ourselves, be able to protect the community, and more importantly, be able to protect our loved ones.
Yeah. So it's quite clear that you are also prompting everyone to get the vaccine.
Absolutely. I mean, the vaccine, remember that actually, if you remember that there is a lot of issues, those of you that actually in the US now, that the President Trump, the ex-president's followers don't want to get it. It turns out that Trump's actually had the vaccine before he left office.
Right.
So don't deceive yourself. And more importantly, do not deceive yourself that the vaccine is not there for you. Many people actually think that the vaccine has been developed very, very fast. Of course, these questions are legitimate, but put it into context. Those of us that came to the country, came to the UK, I remember when I called my mom in Ghana and my dad, at those years, they used to call someone else who's living in the street somewhere else. And then you have to go and call him to come into the phone booths before you're able to speak to your mom. Sometimes it takes, you actually arrange it a day or 2 days before. Wow. Today, you can just pick up the phone and call your mom. Your mom will pick up the phone and speak to you. Technology has changed so quickly. And that's why the vaccine, the way the development is going through that, because we live in a high tech, the technology has improved tremendously. Sure. So every other vaccine follow exactly the same. So don't let people to distract you that this has been developed very, very quickly, especially those of you that love to use your phones and others. It's exactly the same process. Technology is in. So please, if you have the opportunity, just go and get it. It's the only way you can save yourself and save your loved ones and save it. And now you actually know that if you get a vaccine as well, you can even protect others, because that means that your immune system is strong enough for you to be able to pass it on to others. So it's very, very important that you take the vaccine. Yeah.
And does it make us immune? Because someone is asking if that makes us immune specifically.
I mean, what it does is that the vaccine actually protects you to, it gives you the immunity against it, when it comes again. But does not mean that you are not going to infect. Remember that, the COVID can still come in. The issue here, that comes in and the immune system, fight against it. So the fact that, again, this is very important. Many people think that once I get vaccinated, then I can start doing whatever I want to do. No.
Yeah.
Because once you get vaccinated, you can still be infectious. The only thing is that, your immune system is able to fight against it. And that's why even if you get a vaccine, it is very important that for now you continue to follow the rules. You put your mask on so that, if you get it, it doesn't go on into others. So yes, the vaccine can protect you.
Right. Okay. That is good to know. That is really good to know. One other question I had as well. Oh yeah, because this was one I was talking to a friend of mine who is in the UK. Should people prefer which brand or which type of vaccine they should do? Because we've now heard of maybe at least 5 different types around. And somebody told me last time, listen, specifically, I'm going for the Oxford one. What is your observations on that?
Yeah, I mean, as you know, that there has been a lot of the vaccine in the market. You have the, Pfizer, you have the Moderna, you have the Johnson and Johnson, you have AstraZeneca, and then you have the Zeno from the China, and now you have some from the Russia, and others. But I think that what we know is that all the vaccines are protective. Remember that you're going to hear that some of the vaccines are a bit more, for instance, if you take the Pfizer or if you take the Moderna, you have 95%, protection, and some say that the rates are low. Typically, the vaccines, if you get it to 60 and above, you are protected. Right. So the most important thing is actually having the vaccine. So, and all the vaccine that has been tested, for instance, probably we heard about all these. Many countries are stopped, for instance, stop the AstraZeneca a little bit because they thought that was not potent enough, and others. But we know that actually is very, very effective. You know that actually, if you look at the UK is the country that's doing better now because they've vaccinated more people.
Okay.
So the fact of the matter is that the vaccine that comes across is all been proved. It's always been shown to be efficacious. In other words, it's all been shown to be very effective. Right. So my advice to you is that if you go into your GP, or if you go into your doctor, or if you go into wherever, the point is to get your vaccine, just go and get it. Because, if you don't take the vaccine, I'll put it simply, not having a vaccine is more dangerous than having the vaccine.
Right.
This is I would say this is a luxury problem, actually. It's a luxury problem.
Yeah.
So the vaccine, all of them has been proved to be very, very effective. So please, please, please do not start discriminating against which vaccine I should have it, but rather just go forward and just get what is available up to you there. The governments and everything else is going to provide it. And remember, particularly those of us that are in the diaspora, that are in the countries such as Netherlands and others, you have the opportunity to have this. There are many, many countries up there, that do not have the opportunity to have the vaccine. And there's so many people who are very, very desperate to have them. Because they cannot have them, because the system do not support that. Yeah. So if you have it and you say you are not taking it, how do you explain it to poorer countries that are struggling so hard in order to be able to get a vaccine? So my point here is that all the vaccines that have now been approved by the governments are effective. So just get one that is available for you, and then let's move on, and then stop about this luxury issue.
Very well said. And then the last question is there any advice in boosting our immune system to fight COVID, or are the measures the only things that we should uphold to prevent COVID?
Yeah, the thing is that, one of the things is that, certainly the priority now is to prevent the COVID. That is number one. But of course, the immune system, you can always do that. I mean, it's very important that the immunity, you boost it, and that means that eating very healthy food, I would say, ensuring that you do more physical activity, ensuring that just like the basic things that we take for granted, ensuring that unnecessary stresses, you need to take them out, and then ensuring that the food that you eat, and I would say that fruits, nuts, and all those things that actually can boost you, continue to do so. But to say that to do on its own will not protect you. You need to add that together with the preventive measures, wearing your mask, ensuring that you keep the social distancing, keeping hygiene, particularly washing your hands, and ensuring that if you have symptoms and others, you go up and check it out, and then ensuring that you protect yourself and your loved ones. So it's a combination of many things.
Yeah. Okay. Well, on that note, I think COVID has been highlighted a lot in our conversation, and time has flown by just to know about your journey. But it's such an interesting place to also share with us, and also to talk about this COVID thing. One thing that we always ask to all of our guests, if you could shortly share with us one or two major lessons from out your journey in your particular career that you still take with you and you would love to share with other people out there.
Well, thank you very much. I mean, there is so many things that I can actually say about it, but I think that one of the things that for me is what always resonate with me very much is that a couple of years when I was very young, I was doing studies in rural Ghana, and we were measuring people blood pressures and then sort of looking at the and we came across this lady in a very rural Ghana. I'm not going to mention the name of the village, but this lady came in, and we measured this lady's blood pressure, and the machine could not read it. Okay. So you read it and read it. You try, you were all very, very worried what was going on. So in the end, you managed to measure this lady's blood pressure. And I keep on saying this story because it's something that still sticks to my head. And this lady's blood pressure, it is systolic. In the blood pressure, you have the top one and you have the bottom one. The bottom one, if you have 140, then it means that you have a hypertension. This lady blood pressure, the top one, was about 230.
Oh.
So I mean, if it has been in the Netherlands or here, you'll be having what you call the hypertension crisis, hypertension emergency. You'll be calling ambulance and others. Right. And this lady was sitting there. And then we ask her, I mean, you're all very surprised. And then we ask her, are you on medication? And then she said, yes. And then I asked her, which medication? And she said, she was on nifedipine, one of the blood pressure tablets that you use to treat hypertension. So I asked her to bring that medication. She brought the medication, and it's kind of a red. Those of you that are on hypertension might know it. And then medication came in, and the medication is broken into pieces. So the medication is broken into pieces, and some people might think that this lady is stupid. No, she's not. This lady is very, very poor. She's got a young people she's looking after. She needs to go to the farm. She has no money to buy the medication. So her thinking is that I've got this medication. If I break it into pieces, instead of taking me for 10 days, it will take me for 20 days.
A whole month.
So this lady is thinking how to basically to prolong it so that she'll be able to do that.
Yeah.
So, I mean, I said to myself that, I was actually, I was so emotional at the time that I just couldn't just work it out. The point here is that, there are so many people up there who are so desperate to help themselves, but they cannot because of, say, poverty. So if you are sitting in the Netherlands, or you're sitting in the US, sitting in the UK, and you have the doctor, you have the opportunity to have these medications, and you say you are not taking it, how do you say to this lady?
Yeah.
And this lady, if this lady doesn't take this medication, if she doesn't get it, and in the end she's going to develop stroke, that means that she won't be able to go to work again. That means that the children who depends on this lady is going to go hungry. They won't be able to go to school again. So the point here I want to make here is that, the work that we do, it is real. And therefore, you need to be very, very, take things very seriously, because if you don't, the repercussion is huge, actually. So this story, for me, is still sticking in my head, and I still can see the lady. And I really hope that she's alive. So luckily, I sort of talked to people around it, and so that people could go and check on her. But for me, as a scientist going there doing this work, I just do my work, give the policy, and they give it to the governments, and hope that they will make something out of that. But there is so many people up there who are desperately need help. And if you do have this opportunity to be able to, even in some cases, you are lucky, pharmacists call you to come in, even to pick it up. And if you don't take it, what else do you want me to say?
Right.
So this is one of the most interesting things in my career.
Yeah.
That still haunts me today. And it's also making me appreciate how important it is to be human. For my work that I do, as I said, I'm very outspoken, but deep down, I'm also very, very down to earth. I just want to talk to anybody.
Yeah.
And sometimes I even forget that I'm a professor, because professor is a title and others, but the deep down, what it matters is making a difference to people's lives, making sure that people are okay. And for me, this is what keeps me going. It's not the fame. The fame I've achieved it. I mean, Charles Agyemang, many people in the world know me, but that's not important to me. What is important to me is that how can we make a difference to ensure that everyone else is okay? And how do we ensure that, we all go together as friends, as colleagues, and love each other?
Right.
And I think that's what actually keeps me going. And lastly, I will say that, in terms of work, I will say that, it is very important to have a vision and work very, very hard. And more importantly, sometimes many people think that they want to strike a million lottery before they become happy. No. Cherish the very small things that you achieve in life. And for me, sometimes, for instance, if I get a paper published, I can even take a cup of tea and enjoy the moment. So cherish the small things that you achieve in life. Don't wait till you become a millionaire. Otherwise, it will be too late.
Yeah.
Thank you.
Thank you so much for that. Thank you. We have to let that marinate, I think. I think that's really the thing. Man, this was a good conversation. I would like to round up thanking you, Professor Charles Agyemang, for making time to be hanging out with us. Young as we are, and maybe sometimes a bit straightforward with our questions, but thank you for sharing all of the relevant information, not just for us, but for the community as a whole. I really, really would like to thank you. As we're rounding up Africa on Focus, I know we don't need any more people threatening you and haunting you. But if they would like to get in touch, how can they find you? Is there a place where you are maybe
Yeah, I mean, if you just, I mean, if you even go for, how do I say, internet, you put in Professor Charles Agyemang, you will find me. It's as simple as that. But what you can do is that you can also, my email address is c.o.agyemang, as you see here,
right.
at amsterdamumc.nl.
Okay, I've written
So
that in the comment box.
exactly. So c.o.agyemang at amsterdamumc.nl.
All right.
Or type it in, just go to the internet, type in Professor Charles Agyemang. You will get so many information about me. Nowadays,
right.
I hide nowhere, unfortunately.
Thank you so much, Professor, for hanging out with us. We will be following up with you, of course, because this remains a topic that is important. And as long as COVID is going to be a thing, at least we know that your story, your journey, as being a Ghanaian is very important to us young people. So again, thank you, and for your time. And I would say have a good evening.
Thank you so much, and thank you very much for having me. It's a pleasure. Thank you.
All right. Bye-bye.
Bye-bye.
All right, Donnie. Well, here we are. Here we are. Such a good conversation. Yeah, such a good conversation. Next week, I will share my thought on, what I'm going to do with that vaccine. Because I know I told you, like, I'm going to wait it out. I mean, what if something develops, But listening to this brings it into a different perspective. Also catching up with Palgrave's story, who was actually a COVID survivor, also brought it into perspective. Yeah. And just hearing from people that, it's serious. It's not just your usual flu, it's really that serious. So that brings perspective to things. And it also helps me to filter out whatever the conspiracy theory meant to me. Yeah, definitely. Any plans for this week?
No, just the regular, usual, week ahead of me. No big plans, to be honest. Yeah.
Right. That's good. Well, for those of you who tuned in, thank you so much for tuning in with Africa in Focus. If you missed the recap of the show, do visit the High Radio Facebook page where you can watch the show. Also, we have Africa on Focus on all streaming platforms, the Spotify, iTunes, Aftown, and so much for you to catch the recap. We will speed on the recap of this show so that you can definitely tune in to this while you are driving to work or any of that. African Focus is available on all streaming platform. There you can hear our voice and to talk where we highlight. Next week, we are taking on a different direction. We are going to talk about art, the impact, the relevance of art to specifically Ghana, and what that also means to us, and how we should not underappreciate that beautiful painting that could be worth 1 million in a few years. So off we go. We're rounding up with Nafi Marcus. I know I've taken Donnie's time. He's smiling very friendly, but in his head, he's thinking, why did she take my time? But that's all right. Stay blessed, stay safe, people. We're rounding up with Nafi Mar with her record called BTL. Stay safe, and we will be catching you next week.
I've got something on my mind, and it's something more than gold. I've got someone in my life. He captured my heart, he captured my soul. I just wanna spend my time with you. All day long, me and you, we rendezvous. See this love way I did feel for you. Only you fit to me like you do. Oh, na. I will make my melodies to you. Oh, na. I will sing my new songs on to you. And I will bless the Lord, oh my soul. bless the Lord, oh my soul, and all that is within me, yeah. Crown it with your love and mercy, So high the price you pay for me, sapphire. You are good, you are kind, faithful all the time, one of a kind. My past you left behind, you mesmerize me, you entice me, tantalize me, I'm the apple of your eyes. I will bless the Lord, oh my soul. Bless the Lord, oh my soul. Bless the Lord, oh my soul. I will bless the Lord, oh my soul. He has done great things for me. He has done great things. He has done great things for me, for you, yeah. He has done great things for me, for you. Bless His holy name. And I will bless the Lord, oh my soul. All that is within me, yeah. I will bless the Lord, oh my soul, and all that is within me, yeah. I will bless the Lord, oh my soul, and all that is within me. MS.ABA.